Okay, so hello everybody. This is episode 8 of the Redefine Health Ed podcast. I'm your host, Katie O'Bright, and tonight we're going to be talking all things cannabis and what patients and the general public and healthcare professionals need to know about cannabis as it becomes more mainstream and more legal and more generally accepted in our culture and society in America. So I'm kind of excited to talk about this because it's one of those topics that is still considered a little bit taboo in healthcare and in medicine. And but there's a lot of people, patients especially, who are interested in learning more about it. And in turn, healthcare professionals also need to know that much more about it. So I am very, very excited to introduce Drs. Lori Zucker and Dr. Ellen Anderson. And we're going to get started by talking about, they have collectively developed yogi anatomy, which they started, and you guys can tell me more about this because I'm probably going to butcher it. But they started a continuing education programming for individuals that wanted to learn more about yoga and about anatomy together. And I kind of want to know what the evolution of that was from there to now you have a company or a website called PT Cannabis Info. So I'm going to introduce them. So I'll start with Dr. Zucker. Dr. Lori Zucker maintains a private physical therapy practice and is an adjunct instructor at Rutgers. Lori's practice is known for integrating complementary therapies into the traditional practice of physical therapy. She teaches continuing education courses for rehab professionals, highlighting complementary ways to approach patient treatment, including understanding cannabis. And Dr. Ellen Anderson has been a physical therapist and geriatric clinical specialist for over 25 years and is an associate professor of physical therapy at Rutgers. Dr. Anderson's work has focused on the promotion of physical therapy and lifestyle management for special populations, including those with mental illness and developmental disabilities. She's interested in how cannabis may be able to help people manage barriers to a productive life. So without further ado, I really want to hear from you guys. Thank you so much for coming on the show tonight. I appreciate it.
We're happy to be here.
Yeah. So I'll kind of start with you, Lori. If you want to just tell me, how things started. First of all, how did you and Lori meet? How did you guys come to know one another?
So actually, I'm going to let Ellen start and give the background story of how we met and how we came together, and then we'll develop it further. So Ellen, you go.
Yeah, so I invited Lori to be a teaching assistant at Rutgers in a course that I teach, therapeutic exercise. And I think at about the same, somewhere along the line, the two of us began to find yoga. And we decided that we should play a little bit. So we would get together and talk about what we were learning and think about the therapeutic applications of yoga. And from that, we each went in kind of our own separate ways, but we ended up both teaching anatomy for yoga teacher training. And so Laura, go ahead and take it from there.
Right. So we were both teaching, and then, this comes to that. We start collaborating on a few things, and we sort of said to each other, maybe we should teach a course. Maybe there's a place for physical therapists or healthcare practitioners to learn a little bit about integrating yoga into physical therapy practice, into healthcare practice. And now it's been well over 6 years. I can't even remember how long, but we've been teaching workshops, and we developed from there into doing a teacher training. And the more you look into the philosophy of yoga, the more we saw that it was a holistic way of approaching treatment. And then cannabis began to come onto the scene. And when you learn a little bit more about cannabis, you come to know that inside our own bodies, we actually have a chemical that our body makes. And the sort of the name that it was given at the time that it was discovered in 1992 was anandamide. And that name harkens back to a Buddhist word that means bliss. So within yoga, there's the concept of ananda, which is bliss, happiness, a feeling. And then in cannabis, there was this word, and it was like, oh, there's something here. Let's really look into this. Let's teach about it. We already are teachers. We already have continuing education, workshops running. People need to know this. People need to understand this, because much like people did not understand yoga and the benefits in the healthcare world, here's yet another thing that people didn't understand. And so we integrated them, and then it didn't make sense why Yogi Anatomy was teaching about cannabis. So we developed PT Cannabis Info for the same educational kinds of purposes, to help people, distill what's out there, to really better understand this and apply it, obviously, for healthcare purposes.
Right. And I think where the two things really come together is the fact that it can be considered a complementary approach, so that it's not saying only use cannabis or only use yoga. It's saying, let's use some of the best that we know of yoga practices and incorporate that into health and wellness and recovery. And the same is true as far as cannabis is concerned.
Yeah, absolutely. So I actually have something in common with you guys, and I don't know if I ever told you about this, but the one training that was brought to my attention when I very first started to redefine health education, and the actually kind of the thing that made it take off was a Pilates. I had two different programs, a Pilates and a yoga teacher training program, that approached me to teach the anatomy portions.
Okay.
So I am like a longtime yoga practitioner, and I fully believe in the benefits, physically, mentally, emotionally, spiritually of that practice. Now, I'm not a regular practitioner as of right now, but I do want to get back to it, because it is such a healing practice for me. And I have been able to incorporate that with a lot of my patients. And I think that like yoga and, different yoga postures and yoga practice in general, just kind of like the head to toe approach of exercise and movement is becoming a little bit more mainstream in physical therapy. I even myself, I was having like some issues, and I went to a physical therapist who was certified in medical yoga therapy. And it just kind of blew my mind. Her approach was like exactly what I needed. So I am seeing that yoga is definitely becoming a little bit more mainstream. Now I'm curious how you have seen the evolution of yoga from your standpoint, and then contrast that with how cannabis is evolving.
So what I think is happening as far as yoga being integrated into rehabilitation is that when you break it down into the three components, as you're familiar, if you think about breathing practices, meditation, and then the asana practice, they are all practices that physical therapists and occupational therapists are knowledgeable about, but we may not have had the training to incorporate those three things together. And now, as science is revealing to us the real changes that are occurring in the brain and in our physiology by incorporating pranayama or breath, as well as meditation, or even just, let's call it mindfulness, into physical activity and into our rehabilitation process, that it becomes much more valuable for the patient, because he or she is learning those skills that come with finding your edge, and being able to read your body, knowing and understanding how to respond to stresses and what you can handle and what you can't handle. And isn't that really what we want for our patients, particularly those who have chronic conditions?
Yeah, absolutely. Go ahead, Lori.
And I would just say, listening to Ellen speak, obviously, and understanding what's going on out there, I would say that one of the things we're interested in is providing healthcare practitioners, people who are out there in the world, with multiple options. So for sure, there's going to be the person for whom, a breathing technique or a meditation technique or an asana, a physical activity technique is exactly right. But when those things are not right and they're not getting to the thing that the person needs, I do believe that there could be a role for cannabis, and that there's no reason why it has to only be one way. And so a person who's struggling with sleep, let's say, and you do the sleep hygiene and you meditate before you sleep and you do a breathing practice or something, well, it might be appropriate to also add in a botanical, and that botanical could be in the cannabis family. And so the more we understand these things, the more we normalize all the different options, then as a practitioner, you have an awful lot to offer whichever individual walks in through the door. However, whatever that person needs, you have the understanding and the basis to offer them tools. And that's sort of the way I view it.
Yeah, the other piece of it, Katie, is the fact that, so many of us might ask the question, so what do you do to help you relax or feel better? Like, what are your practices? And we need to be prepared to hear even sort of remedies from, my grandmother always says to do this, or I eat chicken soup to take care of myself and always makes me feel better. So one of the things in opening up that communication by what are the things that you're doing to help manage your condition, your pain, discomfort, your functioning, whatever, if you ask the question in that way and you're willing to hear what the person has to say and accept it, it might be that they smoke a little weed, that they go to a dispensary and eat gummies because that's what really helps. And don't we as rehabilitation professionals want to know that and need to know that? And if we want to know it and we need to know it, then we should be educated about it.
I could not agree more. And I think that the way that you said that was just it was very eloquently done. So kudos to you for that. And I might even take that and steal that from you. So can you tell me a little bit about, I know a little bit of the difference just because one of the reasons, or I actually reached out initially to Ellen and Lori because I attended their lecture that they did in Denver at the APTA Combined Sections meeting in 2020, about 4 or 5 weeks before the world shut down. So I'm really glad that I was able to be there. It was totally a packed room, Denver, perfectly appropriate for this topic to come out in an APTA Combined Sections meeting. So I reached out to them. So I know a little bit about it and I remember and I recall, but can you tell everybody what the difference is between CBD? Because there's all sorts of states that maybe medical or recreational marijuana is not legalized per se, but CBD is okay. So CBD versus THC, like what's the spectrum of cannabis?
Okay, Lori, start and then I'll jump in.
Okay, so this is a big story and I'm going to try to give you the Reader's Digest version. Cannabis is a plant. And in that plant, like every other plant and tree that exists, there are different chemical makeups. There are things that help it smell nice. There are different chemicals. So cannabis, when it is grown, has these cannabinoids. And one of them is THC, and one of them is CBD. And then there's a whole host of others. They express themselves within the plant in different percentages and different amounts. If we went back to historic times, they were just plants. But in our time, there's plant husbandry and all different kinds of ways of making hybrid plants. So we have the ability to grow a plant that is primarily THC or a plant that is primarily CBD. There's also within the cannabis family, the idea of a hemp plant that is often used or thought of as sort of an industrial plant. So if you go back 20 years, a hemp plant was used for industry. It was used for oils. It was used for different kinds of textiles. But in 2018, there was a legislative change. And now, 2019, 2020, 2021, many, many people are growing hemp with the express intent of having it express CBD. And so the primary cannabinoid in those hemp plants is CBD. And so plants that are grown, let's say, mostly for THC, that is where you would be talking about words like marijuana. That's where you'd be talking about words like weed or psychoactive, wanting to get high, things like that. Mm-hmm. In the CBD range, that could come from a plant that's a hemp-based plant, sort of, or it could also come in different forms. So the CBD will be in probably most cannabis plants because it's a plant. So Elle, do you want to have anything else?
Just that prior to the legislation that Lori was talking about, we couldn't grow hemp in the United States. It was being grown in Canada. You could get hemp seeds. You could get hemp, clothing made of hemp, but we couldn't grow hemp here in the United States because in the war against drugs, hemp got pulled up into that marijuana plant. And so everything was banned. And now, because you can legally grow hemp, people can legally access CBD. Whereas previously they could only access CBD. You would get CBD through marijuana plants or hemp plants, both of which were illegal.
You look a little puzzled. What do you think?
I am only puzzled because there was just a little bit of a connection issue there. So there was like a pause. Okay. But no, I totally understand. And I'm actually like jotting down a couple of notes because I did not know that about hemp. I had no idea. I remember my recollection of hemp as like somebody who was growing up in, the the 90s and early 2000s was like everybody had hemp necklaces and like bracelets and stuff. Is that like the same fibers? Was that like the fibers from the hemp plant?
Yes.
Yes.
So,
okay.
So actually, that's what you're saying is exactly, it's so interesting. Hemp was and remains a very, very useful plant for all kinds of industrial uses, clothing, yes, wrists and wrist bracelets and things. But when it got swept up, as Ellen said, into this sort of war on drugs, there was actually nothing wrong with it. It could not be grown here, but it remained in all the rest of the world a totally useful thing. So if you had a hemp necklace, it was not that hemp, those fibers were not grown here in the United States legally. It was imported and it was allowed to be imported, but it wasn't allowed to be grown.
Yeah. Okay.
Wasn't allowed to be grown.
Interesting. So I kind of want to switch gears here and talk about, we are in the midst of several different pandemics right now. I guess we're sort of wrapping up this COVID situation. Hopefully, fingers crossed. It at least seems like things are getting back to normal a little bit. And this is me talking in July of 2021 for anybody who listens to this years down the line, which I hope they do. But we're also in an opioid pandemic, and we have been for a long stinking time. And I have been shocked in a lot of ways by opioids and by the amount of prescriptions that come out for opioids. I think that it is moving in the right direction. However, it still is there. And I don't think there's enough education when they are prescribed to patients. So I'm curious what you both think about utilizing cannabis as either as an alternative to opiate medication, and how you think that could evolve in the physicians or other healthcare professionals' prescriptive authority.
Yeah, so we won't give our personal opinion because that's beyond our practice act, but we will talk about the science. And that is that there's growing evidence in publications with studies that have been done to look at the application of cannabis and the process of weaning people down or off of opioids. And there is success in with those people who participate in those studies to use cannabis. Lori, it's Colorado, right? Is the one and only state where the language about prescribing cannabis has been changed. And I'll explain that. So in nearly all instances, physicians don't prescribe cannabis or marijuana. What they do is they verify that a person can have a medical marijuana card. Mm-hmm. So they don't pick the plant, they don't pick the dose, they don't whatever. Except in the case of Colorado, where physicians can actually prescribe cannabis if it's being prescribed instead of opioids for pain.
So that is true, and I think that was because of COVID. I might be off, a 2019 or a 2020 news piece in Colorado. But even, as Ellen said, even in states where medical marijuana is approved but adult use is approved, when they track sort of the epidemiological looking over things, they see less pain medication purchased. And so even though they can't necessarily give a causality there because of this, that, they can say in the states where this is allowable, we are seeing a reduction in the need and the cost and the purchase of a variety of pain medications, not just opioids. Because let's be honest, some people can't use ibuprofen. Some people can't use the NSAIDs for whatever other medical reasons. People can't use certain things, or they don't like the side effects. Mm-hmm. But the side effects of cannabis are more tolerable. So it's both.
But I want to add a word of caution, however, and that is there are still institutions in states where there is medical marijuana and adult use allowed, but a patient goes to a pain physician in a particular system, hospital system or whatever, and that physician cannot prescribe cannabis.
Yep.
And if that person asks for a medical marijuana card, that person is discharged because it's viewed as interfering with the medical management, which is to take opioids.
And by the same token, I have had patients who, here in New Jersey, have a medical marijuana card and are going to a new doctor for the first time. And to be honest, I often counsel them to just wait and don't reveal that they are potentially using cannabis until the doctor gets to know them, because actually there remains a bias. It's changing even in the last year. In the last year, I see it. I hear it. There's an experience of that, but I think that sometimes you have to be careful. And this is maybe not very PC, but particularly if it's a woman. If it's a woman with chronic pain or something like that, let's develop a relationship with the doctor first before you share all the information, because there's that other possibility that they'll say, oh, well, if you're using, marijuana, then you don't need a pain medication, or you don't need Xanax, or you don't need Valium, or whatever the circumstances are. And so while it's changing, I don't think it's there yet.
Okay, so I'm a little bit mind blown, to be honest, because I know that I'm a veteran, and there's plenty of people that that receive care at the VA. The VA is federally funded, therefore the VA and anybody in the military or anyone that's receiving care or providing care in the military health system is not allowed to prescribe or to I guess what is the word, like authorize, certify a medical marijuana card or prescribe medical marijuana. So I did know about that, but I was unaware that just even the notion or bringing it up or asking would potentially result in discharge in some places. That is crazy. I mean, that's just I'm kind of speechless. But I'm also not, I'm not surprised, because I am aware of the biases that still exist with certain healthcare professionals about marijuana and about cannabis in general. And I understand how somebody could be maybe deemed like a drug user or a drug abuser if they talk about their use of cannabis. And what would you want to say, or how would you want to educate those healthcare professionals, or what would your word of advice be to patients on that note? We could go in so many different directions here.
Well, I mean, I'm not sure exactly what is the right thing to say in each instance, but the truth is that since this is such a new experience in healthcare, the adage of start low and go slow is always appropriate. So that, for instance, I have a close friend, lives around the corner. Her father is 91. He is significantly struggling. He's had a couple of open heart surgeries. He was a vibrant man. The heart surgeries really frightened him. He's got a little anxiety. He's not sleeping so well. He actually is improving. He's physically doing well for a 91-year-old who's had a bunch of different things, a UTI, a this or that, but he can't sleep. And the more nights that he's not sleeping, the more nights he's getting anxious. His blood pressure, everything is being screwed up. So she said to the doctor in front of him, how about some cannabis? Could we do that? He doesn't want to take more Xanax. He's afraid of it. And the doctor's like, go for it. But make sure that what you give him is high quality CBD or tested high quality stuff. So she comes in, she asks me, she's terrified. The family is terrified. He's like, I don't want to get high. I don't want to do this. I don't want to do that. And I'm like, the education of, hey, not everything is going to get you high. There are many ways to do this that can truly help you. The research is behind you that a little bit of THC helps with sleep. There's another cannabinoid, CBN, that has been shown in animals, not in people, but in animals, to help with sleep. Certain things like that. And so I just said to her, look, here are your options, but he's 91. The doctor has said it's okay. Start slow, start with the lowest amounts and observe and see how you go. And that's really what you have to say to patients, because at 91 years old, think of all the years that he lived with say no to drugs, and all the messaging. And now here he is in a situation where his family and his doctor are saying, yeah, go ahead, go for it, buddy. It's like a shock.
I think it also depends on the patient and what they want to talk about, how much they're interested in, because as a healthcare provider, you could say, listen, that cannabis was classified as a Schedule I drug erroneously. That was wrong. There were papers that came out. There was the AMA that came out and said, don't make this illegal. By you making it a Schedule I drug, you're saying that it has no medical benefits. And there's thousands of years that demonstrated that cannabis has medical benefits and that the classification was a sham. So with the Schedule 1 classification, it scared a lot of people because it was talked about that it was a drug. Is untrue. And in educating patients, it's good to be able to confidently say that the classification of marijuana as a dangerous drug is incorrect. And in fact, there are perhaps many other drugs, and you may have taken them in the past, that were much more dangerous if not controlled. And we're talking here about using cannabis in a very controlled, systematic kind of way to help you manage your symptoms that haven't been able to be managed by everything else you've tried.
I mean, I think that is so incredibly reasonable. And I mean, look at the hole that we have dug ourselves into with narcotics. I mean, it's just, it is shocking to me that at some point in time, somebody, physicians, legislators, whatever, deemed that narcotic medication was a-okay for pain control, for this and that cannabis and marijuana was not.
Right. Well, you also got bamboozled into thinking that people shouldn't have pain. And there are many places in the world where a narcotic is not prescribed, where you're told to take a little Tylenol or a little Advil and relax, take 2 weeks off from work, have a cup of tea, put your feet up, and don't push yourself too hard. And guess what? Those people get better without narcotics. Here in the United States, it's like, no, I have 1 day off from work and I've got to get back to it, within 48 hours. And therefore, I need to block my pain because I'm still healing. I could just sit, take a break, have a cup of tea, but no, I have to get back to work. And the only way I can do that is to block my pain. And the only way I can do that is with a narcotic. Mm-hmm. Yeah. It's messed up.
I mean, I have in this podcast or in other conversations that I've had, there's been a couple of moments where I've been deemed speechless, and this is definitely one of them. So what do you think has been responsible for the shift or the shift in healthcare? Do you think that it's primarily consumers that have lobbied for this, or do you think that it's scientists that are finally kind of figuring it out that there's some value to it? What has been responsible for this shift?
Lori's the history expert on this whole thing. So, it originated, right, Laura, with compassionate use, compassionate care.
Yeah, compassionate care is really, Ellen's right. This whole thing took off with compassionate care. That isn't to say that 30 something years ago, there weren't, legislators or people who were lobbying and trying to teach and trying to change things. But it wasn't until there were people sitting in front of the legislators and looking them in the eye and saying, I am dying. There is nothing out there for me. You pharmaceutical industry, you got nothing for me. And this substance is helping me. And what are you going to do? Are you going to throw me in jail? What are you going to do? And it slowly began to eat away. There were people, Charlotte Fiji is one of them, a little girl who had an intractable form of epilepsy. And because of her and many other people who were supporting her, they pushed Colorado, they pushed California to allow people who were struggling to use this, and then everything started to snowball. Actually, the research is trying to catch up to the commercial claims. So there are many, many commercial claims of what cannabis and the cannabinoids and the terpenes and all these different substances can do. There's not anywhere near as much, true research. There's, randomized controlled clinical trials, placebo controlled clinical trials, but actually That's because it's still a Schedule I drug federally. And literally not until 2 or 3 months ago, there is one crop at the University of Mississippi for which the federal government will allow cannabis to be grown. It has been there for a long time, for probably close to 30 years. And that is those are the only plants that are allowed to be used for research until right now. Now there are 3 other sites that are that they're looking into that will be able to provide researchers with cannabis in order to do the research that we all need.
Mm-hmm.
So right now it's anecdotal. They do the epidemiological studies. What are you using? How are you using it? And what are you saying it helps? But the placebo-controlled trials that we need, not there yet.
Okay.
At least not in this country.
And a lot of that has to do with the fact that it is still federally a Schedule I drug.
Right.
Yes.
Some of the early work that was done, that was allowed with some of these plants, was able to get funded because the researchers had to say that they were looking at the negative effects of cannabis. They couldn't say in their application to study the plant and its effects that they were looking for the medical benefits. They had to say that they were looking for the harms of cannabis. And short of, selling your firstborn child, researchers had to go through tremendous hoops, tremendous cost, years in order for them to be able to even do the most basic kind of research. And researchers have lost their jobs at institutions because they wanted to pursue studying cannabis for its medical benefits.
There are some people that have a Schedule I a license to do research with Schedule I drugs, but keep in mind, since they're not legal, how do you get a research subject in, do the intake, evaluate the situation, and then you can't give them the drug? You can't give them marijuana and say, go home and come back tomorrow or the next day or the next day. So this Dr. Margaret Haney at Columbia, she has a residential lab. You have to go and live there. You have to go and stay in order for her to do research with cannabis over a period of time.
Wow.
Because you can't send somebody home with it because it's federally illegal. So some of that is actually changing because within certain states where cannabis is legal, if a state funds some research, let's say a university at that state or something, or private monies, so then you can stay within the state and do that research.
Mm-hmm.
But otherwise, no. It's really remarkable the way this all happened. And one of the things that we talk about and we've taught is that as far as we know, there is no other medication that is legal that is also over the counter in such a way. Like you don't get a prescription for your cholesterol medication, but then also go to a store and like buy a little if you feel like it. It doesn't work that way. Your heart medications, your beta blockers. Nobody puts beta blockers in their coffee or has a little beta blocker because they kind of think maybe it would be good for them.
Yeah.
So we're in a very bizarre circumstance in how this, is it a medication? What do we want to call it? How is it being used? I
find this so interesting because you're exactly right. And I've thought about that myself. Like if it is medical and it has medical use and it is prescribed, why can I here in Illinois just go and buy it for a little bit higher tax rate? I do wonder about what the evolution of this will look like as more and more research does come out. And let's just say, just for the sake of this podcast, let's just say that the research that's going to come out is going to show that cannabis is awesome and it does so much better than placebo for pain control, for sleep, for whatever. then does it become prescribed only and not over the counter? I do wonder about the evolution of that. Can you comment on that?
Yeah, I don't think it'll go back,
Yeah.
because if we think even about like where extra strength Tylenol came from, right? Whatever, like that, the dosage, Lori can rattle off those dosages off the top of her head. So go ahead and do that. But I view it as it's an over-the-counter drug. And that's one of the reasons why we need to talk to our patients about it, because when we do an intake, right, we're saying, okay, so, do you take any medication? Somebody comes in with high blood pressure, like you're like, did you take any NSAIDs today? Like, what's your pain medication like? When did you take it? Like, is your blood pressure a little bit higher because of the medication that you're taking? If they're doing over-the-counter drug application for whatever, cannabis is an over-the-counter drug in many states.
Mm-hmm.
So Lori, go ahead.
I would venture, I mean, who knows where this is going to go, but let's just assume, as Ellen said, like Tylenol, ibuprofen, they were all prescription drugs at one point.
Yeah, diclofenac too is
right, diclofenac
cream, and it was recently just made over the counter.
So, I have for many, many, many years, I'm telling you, it could be 20 years. I have been buying diclofenac cream and sprays in Israel, in Europe, and it wasn't here. Then it was a prescription here for a tiny little tube. It cost a lot of money. Now, all of a sudden, it's exploded here and it's all over the place. And everybody's saying, go buy it. Because why? Because they figured out that it was safe. Within the confines of the way most people use it, it's safe. And if we come to find out, my guess is if we come to find out that cannabis is safe, it will likely be that medicinal marijuana, the reason why it remains like medically certified is for tax purposes, because you don't pay taxes on your beta blockers, on your cholesterol medication, on your kidney medications. But right now, people do pay taxes on their medical marijuana and certainly on their adult use. Mm-hmm. And here in New Jersey, if things go the way they're supposed to, over the next, I believe it's 5 years, the tax on medical marijuana is supposed to decline and come to zero. The tax on adult use, recreational use, whatever word you want to call, will remain taxed like other things do. And then we'll have to deal with that situation. Mm-hmm. So I really think it's a commercial financial thing until the federal government moves and makes a change. But it's about safety. Why? Look, why can you now buy medications over the counter? Simply because they've been deemed safe. Mm-hmm. All the antihistamines, Claritins and Prilosec and Nexiums, they were prescriptions.
Right.
So, if the insurance company is required to pay for cannabis as a medication, it will be over the counter very soon. They will not want to do that.
Oh, you're so right on that. So we're getting close to the hour here. So there's so many more things that we could talk about, and we could easily, oh my gosh, we could probably go for a long time. And I know you both are so knowledgeable in this topic, but I just want to quickly wrap up and say, or see if there's anything else that you want individuals to know. And then we'll wrap up by you guys letting everybody know how people can find you, how they can contact you, your website information. So yeah, wrapping thoughts.
I don't really have anything. Lori, do you have something?
I think my thought, if somebody were to just come upon this podcast, is to encourage everyone to just have an open mind, to try to let go of the messages that came to us through society, through our parents, through school, through government, everything. Because when we here in New Jersey were voting, and it is remarkable that we voted on whether or not something should be able to be used as a medicine or able to be an over-the-counter drug. You did not vote on whether or not you wanted Sudafed in the pharmacy.
Wow.
But
Yeah.
we did. But when it was a vote amongst my friends, there were the yeses and the nos, and the nos were fear. And they were straight out. They were honest. I've watched my kid. I had a family member who was addicted to this. I saw the way, cannabis, impacted X, Y, and Z. And there was no amount of my talking to people to try to explain what was going on. And so in the next 5 years, as this comes through, there'll be the group that's very open-minded, and there'll be the group that's more dictated by fear. And so if somebody could be open-minded and allow us to teach, maybe we could have a better handle. There'd be an awful lot of control that a person could have, a healthcare practitioner could have, a family member could have over cannabis if they learned more and let go of what they had heard before. And so that would sort of be my closing wish, that something like this podcast and any of our teaching is just learn more, you'll understand it better, you'll have better control, and then the mystery is gone. Then the mystery is gone.
That is beautiful. So if people want to contact you, how can they get in touch? Where can they find you?
So our website is PT Cannabis Info, and you can send an email to info@ptcannabisinfo.com. And yeah, right. And both Lori and I will get those emails, and then usually what happens, it's like, do you want to handle this? Do you want to handle? So we'll go back and forth, and usually it's a joint effort on how we respond to the questions that we get. To PT Cannabis Info. Yeah.
And on Instagram, the PT Cannabis Info on Instagram, we post some stories and we post some interesting articles. Again, the majority of our interest is in education. So that's mostly what we're posting.
Yeah, so our website will have that as well. It'll have a few little snippets, a few little little things. I think there's a marijuana math on there. There's some other kinds of little sound bites of information that might be helpful for rehab professionals if they just want to learn a little bit more about cannabis.
Excellent.
I think the thing I'm most proud of on our website is the glossary of terms.
Right.
Because there's, you just don't know them. You hear the word, even if I were to say to you cannabinoid or anandamide is something that I used earlier, like it's all written out there. Where did it come from? How did it get there? And so that for all of us, this is new language. And so, it's a good resource.
I'm definitely gonna take a look at that and make sure that everybody's aware of that. I'll put all of this information in the show notes for tonight. And another thing I want to mention, of course, through Redefine Health Education, Ellen and Lori have put together an awesome series, which is going to be scheduled in the near future. We're in July 2021 now. It's either going to be sometime in the fall or the spring of next year. And the two lectures, the first one is entitled Cannabis, Cannabinoids, and the Endocannabinoid System. So it's an introduction to how those systems work in the body. So more the physiology behind how it interacts with our body and system. And then the second portion is cannabis. What healthcare providers need to know about cannabis. All you want to know about health from a healthcare provider perspective. So there's tons of healthcare professionals out there. This is really for anybody who just wants to learn a little bit more. Maybe you don't know a whole lot, maybe you know a lot, but still more healthcare professionals need to become knowledgeable in this. So Ellen and Lori, thank you so much for this tonight. This was really, really interesting. And I actually learned a lot in this conversation, and there's probably so much more that I need to know, but like I said, I will post Ellen and Lori's contact information in the show notes. And without further ado, that's a wrap.